Hi, this is Dr. Nick and I'm the Incrementalist. This week I'd like to talk about the new guidelines that have come out from the AHA and the ACA that have essentially reduced the clinical indicator for hypertension, or high blood pressure as it's known. They've reduced the guidance to say that if your blood pressure, the higher number, the systolic number, is higher than 130, previously it used to be higher than 140 millimeters of mercury, or the lower number, the diastolic, which used to be at a level of 90, now they've reduced that to 80. So if your blood pressure now exceeds 130 over 80, that's defined as hypertension. What's the impact and what does that mean to me as a clinician? What does it mean to me as a patient? Well, I think what they're saying is that blood pressure is an extraordinarily important indicator and significant value in terms of future health and your health in particular. So from a clinician standpoint, what it's done is made us more acutely aware of people that maybe were on that borderline and we now consider would be hypertensive and would require additional treatment and more focus. And from a patient perspective, what that means is that if your blood pressure was bordering on one of those numbers before and you're now in the group that's considered hypertensive, you should really take that much more seriously. What's interesting about the guidelines is it's not about more pharmacological intervention. In fact, what they specifically say is to be healthier, so focus on food, diet, exercise, and improving lifestyle so that you can reduce those blood pressure numbers. But indeed, if you can't, it's going to be incredibly important to actually focus on that and treat that in some fashion to bring it down so that you can actually improve your overall quality of life and indeed your health. What's interesting, we saw from a survey that Higgy does, they have a pretty substantial database that impacts 61% of people are now considered in the hypertensive range, and that's going to be a significant problem for the medical profession, the healthcare profession, to deal with all these extra people that are now being categorized. And I think there was certainly some geographic variations that you can see in that chart that seem to imply that there's even more of a problem with hypertension in Florida and Alabama down in the south. That could be that we've just got older people who suffer from hypertension or suffer from hypertension at a slightly higher rate. But overall, what would I tell you? Well, I'd tell you that you should focus closely and intently on your blood pressure. It's an excellent indicator. It's something that we shouldn't just record when we go and visit the physician's office. There are plenty of opportunities like those at Higgy and other publicly available measuring devices. But I would also encourage you to buy your own. I have my own blood pressure machine at home. I try and do that on a regular basis, measure it as soon as I get up. Before breakfast, after breakfast, during the day, before exercise, after exercise. It's not just one number. So don't focus on the single number, and if a single number is elevated above the current guidance, that doesn't mean to say that you're hypertensive. But what it does mean is that that's something that you should be paying attention to and focusing on. Overall, I'm excited about this. I think it's good news. The other thing that I would say, and this is interesting from my own personal activities working with Base Health as their Chief Medical Officer, is this was not news to us. This is something that existed in our guideline. The 150 million odd articles in PubMed have essentially given us risk factors that we can see and clearly identify and link the evidence to disease. So in fact, this is affirming what we found in the data and apply to our customers and to their patients. So really what we're doing at Base Health is accelerating the process of getting that knowledge and insight into clinical practice. One of the things that we know is that it takes too long for scientific knowledge to reach actual intervention and practical application. I've talked about that in my blog in the past. So good news, we're seeing new insights and important insights into healthcare and into the blood pressure and the significance of the blood pressure. We at Base Health will continue to advance that and bring those advances to our patients and focus on that extra care. And in fact, I'll be doing a blog post about that very soon to try and tie all of that together. In the meantime, I would wish you great health. Enjoy the outdoors, get more exercise and focus on your health overall, and indeed focus on your blood pressure. I'm Dr. Nick, and I'm the Incrementalist.